Is ventilation equal in the lung? Question, sorry, that's a question. Answer, no, right? The ventilation is not equal along the whole lung, right? Yeah, it changes. It depends on gravity. So gravity can affect ventilation, right, in the lung. How much air gets into the lung, or which part of the lung, which zone, depends on gravity. Also, gravity can affect what? Lung perfusion as well. How much blood flows to the lung. Which kind of makes sense, right? Yeah, gravity can oppose blood flow. So if you divide the lung into three zones, apical, imagine someone is sitting upright or standing up, right? Apical, mid-zone, base. This also applies if somebody is lying down as well. So this also applies if I'm lying down. Of course, the part of the lung closest to my chest wall will correspond to the apical lung, part of the lung if I'm sitting up. Mid-zone, as well as the part of the lung at the back, because of the base as well if I'm sitting up. Yeah. If I'm lying on my side, right, same thing. The part of the lung closest to the top of my ribs corresponds to my apex, the mid zone, and then the base, the parts at the bottom would be the base, right? So it applies as well. This principle applies no matter how the patient is, right? Sitting or lying down, whatever. Okay, so the pleural pressure, right? So look at this. In the mid zone, imagine the mid zone is normal, like baseline. It's equivalent to being at baseline. So look at the pleural pressure. PPL here means pleural pressure, right? Like we said, the pleural pressure is usually negative at baseline, at rest. So in the mid zone, pleural pressure is negative 5 centimeters mercury, right? But what happens to the top of the lung, at the top? And then let's look at what happens at the bottom. So imagine that at the apex of the lung, right? Gravity is like a weight. You put a weight, right? Attach a weight to the apex of the lung, like this. What will the weight do? The weight will pull the apex, right, downwards. So imagine gravity is like attaching a weight, 10 kg weight, to the apex of the lung, apical lobe of the lung. What would that do? What would the weight do? The weight pulls the apex down. If you're pulling the apex down, what happens to the size? Look at the volume. What happens to the volume? The volume increase. Can you see how wide the alveoli is at the apex? They become wider, which makes sense. They are being stretched, pulled downwards. They're going to expand. Now, if they're expanding, right, what would they do to the visceral pleura? They're going to pull the visceral pleura, right, along with them. Remember the visceral pleura attached, the part of the balloon attached to the lung. So I'm pulling the apex down. I'm going to be pulling the inside layer down as well. If you're pulling the inside layer down, what happens to this volume in the pleural cavity? There's a pleural cavity here. What happens to the volume here? It increases. What happens to the pressure? Pressure goes down more, becomes more negative. At the base, it's going to be the opposite. Look at the base. If imagine that the base of the lung, we have a weight, 10 kg weight sitting on the base, not pulling down now. It's sitting on it, which means it's compressing the base, right, of the lung downwards. So you're going to see the opposite effect. The lung here at the base will be compressed. Their volume is decreased. And what would it do to the pleural here? The pleural here will be pushed downwards as well. The visceral pleura down there. What happens to the cavity size, the pleural cavity? Decreased volume. What happens to the pressure? Pressure will rise. So you can see the pressure there at baseline is actually what? Higher than the mid zone, right? At rest. And we already talked about the alveolar volume. At the apex, increased volume, which means the pressure will be low, opposite. Intermediate in the mid zone, in between, and then we have low volume in the bottom because now you're compressing, sitting on the lung at the base, and then we have what higher pressure, right, in there because they're smaller in volume. So, question: where is ventilation going to be highest? Apex or the base? Where is ventilation? Air moving into the lung going to be highest. Where will most air enter?
Definitely highest at the apex.
Ventilation, you think ventilation will be highest at the apex?
Regarding ventilation, perfusion, I think the ventilation is higher at the apex and perfusion is higher at the base.
They are both high at the base.
Okay.
Yes, they are both highest at the base than any other zone. Although perfusion is much higher than ventilation at the base, but both of them are high. So look at the apex. Okay, so why? Look at the apex, right? Look at this. So apex is distended. I want you to think of it as a balloon. So I take a balloon, I already inflated it, right? To maybe 99%. How much more can you inflate that balloon? More or less? Balloon is already inflated at 99%, and I say, okay, Shani, how much more air can you get into that balloon before it bursts or ruptures? Can you get more air in or less if it's already at 99% inflated? What do you think? Already inflated a balloon to 99%. How much more can you inflate it at that point?
Well, it can go to 100, so I'm guessing that it can be inflated more until it goes.
Right, but how much more? If I'm talking at 99% already, how much more do I need to go to get to 100 maximum?
1%.
Is that more inflation or less compared to where you're starting from? Compared to starting from
Less.
zero? Less. That's the idea there. It's already inflated, right? If already inflated, how much air can I add to it? Less. Not much anymore. I can't go further. But if the balloon is starting at zero, I've not inflated it at all, and I start inflating at zero, how much air can I get in? As a lot more than I would if I'm starting at what? 90% inflation or 99% inflation. Same thing. What is the volume of the apex of the lung? It's already increased, they're already inflated. Gravity is pulling them down, their volume is increased already, they're already inflated. So how much more air can you get in during inspiration? Less air. They're already dilated. They can't take more air at that point. So ventilation will be low at the apex. They're already at baseline, they're already inflated. Right. The pleural pressure is -10. More negative. Those alveoli, they're gonna be dilated. They're gonna expand. So if I start inspiring, right, getting air in, I can't get more air in anymore. They're already filled with air. Distended. That's it. But you see the base, their volume is small. They have the smallest volume. They are compressed by gravity. So on inspiration, they have more potential to expand on inspiration and fill with what? With more air. Right. So that's why ventilation will be highest at the base, lowest at the apex is going to be like mid zone, right? Intermediate in the middle. Perfusion will be highest at the base as well. Why? Because of what? Gravity, right? The base is below the heart. So gravity will push blood, right? More blood to the base, which makes sense. And the blood going to the apex, right, will struggle to rise right, up against gravity. So the perfusion at the apex of what would be the lowest. Would be the lowest.
So to clarify, right? Because I'm getting kind of mixed up now. Because initially I had thought, before they normally say that ventilation is higher than perfusion at the apex, and for the base, perfusion, which is said here, is higher than perfusion is higher than ventilation at the base, right? So which is true here for base. But at the apex here, it's saying that both of them are low. Ventilation is low and perfusion is even lower. So is it that at the apex,
Mhm. Go ahead. Go ahead. Is it
so
that the
it's saying
apex?
that ventilation is not higher than perfusion at the apex of the lung?
At the apex, ventilation is higher than perfusion.
Okay, so then
It's the
why is
same thing as
perfusion?
saying perfusion is lower than ventilation, isn't it?
Okay, okay.
Right. They are both low. Which one is lower? Perfusion,
Mm-hmm.
but they're both low at the
Okay.
apex compared to other zone. Now, remember, when you say ventilation perfusion at the apex, you're comparing ventilation at the apex with perfusion at the apex. I'm not comparing ventilation at the apex with the other zones. I'm comparing, okay, now I'm already at the apex compared to other zones, mid zone and base. What is the ventilation perfusion at the apex? They are the lowest at the apex compared to the other zones. But which one is much lower than the other at the apex? Perfusion is much lower than the ventilation at the apex. They are both low. Perfusion is much lower than ventilation, which means although they are both low, ventilation is higher than perfusion, right? Right, it's the same thing. Just make sure you know what they're talking about. But in your mind, just know apex, both low. Which one is lower? Perfusion than ventilation. Base, both high at the base, but perfusion is higher now than ventilation as well at the base.
Okay, got it.
Make sense?
Yes, thank you.
Right, now if you now check the word ventilation perfusion ratio, I take ventilation and I divide it by perfusion. What will I get? Will my ratio be more than 1, less than 1, or 1? What do you think?
It would be for the apex dock.
Yeah, for the apex, yes.
It would be more than because it's more depth.
Exactly, it's gonna be more than 1. Because perfusion is way lower than ventilation. So my denominator is lower than the numerator. I'm going to get a number greater than 1. So the VQ ratio at the apex is greater than 1, and it can go as high as what? As infinity, which corresponds to what? Alveolar dead space. You remember what we say dead space mean? Alveolar dead space is the part of the lung, the respiratory zone, that normally should participate in gas exchange, but it's not participating in gas exchange. Why? Because I have ventilation more than perfusion. I'm not getting enough blood there, right, to pick up all the oxygen at that point. So that is VQ ratio at the apex. Greater than 1 is a dead space. There's wasted ventilation, to put it another way. Ventilation is wasted at the apex. I have more air, more oxygen, but I don't have enough blood, right, to pick up all the oxygen. So compare, you can see this is another way an examiner will try to confuse you. So be careful. We already know ventilation is low at the apex, right? Perfusion is low at the apex. If they're asking me which part of the lung or zone is most aerated, has the most aeration, most oxygen is most oxygenated, it's gonna be the apex. It has, although ventilation is low there, perfusion is also low. But because I have more air than blood flow, there'll be wasted air there. Too much air that's not entering the blood, basically. So it is the most aerated part of this lung, wasted ventilation. But the base now, where although both of them are high, perfusion is way higher than ventilation. My ratio is what? Less than 1. I will call that a shunt. Any blood that goes through the lung without picking up oxygen is a shunted blood. Right, because if I have perfusion, too much perfusion to the base, but I don't have oxygen, enough oxygen there, right? Some of the air some of the blood, right, that flows through the base will not pick up any oxygen. They're gonna remain deoxygenated, right, even after leaving the lung. Yeah, I'll call that what a shunt. And then the mid zone will be they usually match. The mid zone we have properly matched ventilation and perfusion, so that's the best, right? Gas exchange, right, in the mid zone. So at the apex, we're gonna have what? We're gonna have it's almost um hyperventilated, right? Like it's hyperventilated basically at the apex, it's hyperaerated. So which means there'll be a lot of oxygen. The blood that flows through the apex will be highly oxygenated, more than the base. It's gonna have what? Low CO2 level, the lowest CO2 levels, but the highest, right? Oxygen levels at the apex. It is hyperaerated, ventilated. At the base, I'm gonna have blood flowing through there where they're gonna have the lowest oxygen content, but and the highest CO2 because there's no air, enough air there, right, for gas exchange. Yeah. Why the mid zone we have, right, just the appropriate amount, right? Average, basically. This explains why aerobic bugs, right, love the apex, like TB. TB loves the apex of the lung. Tuberculosis loves the apex of the lung. It may also explain why maybe anaerobes love the base, although it has to do with anatomy as well, right? Where we aspirate goes to the base because of gravity, but they're probably going to be able to survive there, right? Because also there's not enough air there, right? Compared to oxygen, compared to blood flow, so it's hypoventilated relative to the apex. If looking at the ratio, BQ ratio, and anaerobic bugs can survive more, right? And abscess probably at the base and stuff, mid zone. But the apex, mostly aerobic bugs, right? Like TB, they love to cause reactivated infection. Right? At that point, there's excess air there, wasted ventilation. All right. Any question on this before we move on? So don't make it complicated. It's as simple as it looks. Right. Don't make it complicated. And pay attention to the wording, right, in the options of the examiner's wording, right? See if they're comparing zones. If they're comparing zones, right, be careful. If they're comparing ventilation operation at the same zone, right, looking at the BQ ratio, different interpretation, right? So be careful with that.
Doc, I have a quick
Right,
question.
should.
So okay, so because I'm getting a bit confused now. So
Okay.
you said that ventilation is more at the base compared to the apex, but is more aerated at the apex compared to the base.
So what will determine the overall? Okay, so ventilation is more, yeah, at the base than the apex. Okay, but look at blood flow compared to, because you're not looking at just only ventilation, you're looking at the perfusion as well. If I have a lot of air, right, in the base, and I also have more blood flow through that base, what will the blood do to the air there? The blood will take, right? There will be a lot of gas exchange there. The blood will take the air. So what happens to the air? There will be air deficit. I don't know if that makes sense. I have more blood, way more blood than I have air. So there will be air deficit, right?
Yeah.
At that point, all the blood flow, most of the blood that flows through there will pick up all the air there, basically. So there will be air deficit. So which means it becomes what? It is hypoaerated. Like the air that is there will be low overall compared to perfusion. Because they have too much perfusion. Too much perfusion, there'll be air deficit. It's going to take up all the air there, air deficit. But look at the apex. Although the ventilation is low, fine. Perfusion is also very, very low. It's actually lower than ventilation. I have less blood to the apex. How much of the air in the apex will the blood flow there take? Less blood, because there's little blood going through there. So what happens to most of the air at the apex? They're going to remain at the apex. They won't enter the blood. I don't know if that makes sense.
That makes sense.
So there's air excess at the apex. Does that make sense? Right. That's why we see the apex is what? Hyper-aerated. We're not looking at ventilation per se now. We're just talking about overall. Compared to the base, it has excess air that are not participating in what? In gas exchange. So there's going to be oxygen there, but it's not entering the blood. There's no blood to pick it up. At the base, we have oxygen. Almost all the oxygen will enter the blood because we have too much blood, way more blood than oxygen. So almost all the oxygen will enter the blood, and there'll be less oxygen remaining at the base. So it becomes what? Hypoaerated. After exchange, apex will become hyperated. There's air excess after exchange. So what we use those air that remains there? Organisms that love air, they're gonna go there, like TB, and use all the oxygen there that is remaining. So that's what I mean by hyperated, right? And hypoaerated. You're comparing now the BQ ratio. The consequence of that, having less ventilation or way less perfusion than ventilation, it means there will be air excess. Some air will be remaining there at the apex that will not pass into gas exchange. If I have too much blood, way more blood than ventilation at the base, almost all the air there will participate in gas exchange, and there will be air deficit. There won't be a lot of air remaining there. So it becomes hypoaerated. Oxygen poor zone after exchange. Make sense?
That makes sense.
Okay, right. Yeah. So these, yeah, so I get the confusion actually, but be careful. See, once you know this in your mind, I don't mind you guys writing it out quickly in a piece of paper or whatever. Once you get into your exam, even if you're going to forget, it's probably going to be one of the things that can be on your cheat sheet. Yeah, quickly write it down. Any question you see on this, just interpret it correctly. The principle doesn't change. So if, right, just pay attention to what the examiner wants to do. Are they comparing one zone with the other zone? So big, then you're going vertically on the table. If they're comparing ventilation, perfusion, VQ on the same zone, then you're going horizontally. Don't go downwards. You're looking at the table horizontally or along that zone. Right? The examiner is comparing apex with the base, apex with the mid zone, right? So that you're going vertically. So this will be more than this. This will be right. But if you're going comparing at the same level, same zone, then you're going horizontally. Yeah. And then that would have almost have like different interpretation, right? Compared to going vertically, right? So be very, very careful. Okay.